Saki mbwembwana kwele mchele kwa kuku kumwaga. Sako na wapenda yatusema nitasikia.
Hello, my name is Susan Wood, and I have been invited by Unite for Africa to speak with you about my passion, which is nursing. And I'm delighted to be here to share with you for a few minutes the reasons I got into nursing and hopefully convince you why it is just the most wonderful career in the world. I am a nurse practitioner, which is an advanced practice form of nurse, and I have been a nurse for about 40 years. I wanted to mention, too, that this is the year of the nurse and midwife as designated by the World Health Assembly, the governing body of WHO. And so I'm also going to share with you that we are celebrating nursing all over the world and hopefully letting you all know how wonderful a profession it is. And it is also, ironically, the 200th anniversary of the birth of Florence Nightingale, and she was the real founder of modern nursing. So this year is a very important year. I spent most of it in Africa, in Tanzania and Malawi, teaching nursing under a Fulbright Scholarship. Sadly having to leave because of the COVID-19 pandemic. But I want you to know that my career has spanned many different facets, and it didn't stop when I left Africa. I actually became a contact tracer in the pandemic. And I think I just want you to know that nursing has many, many different permutations, different forms. There's so many ways to make it apply to your strengths and your skills. Mine have always been in pediatrics, and particularly maternal newborn pediatric care, where I worked as a primary care nurse clinician as part of Children's Hospital for many years, and took care of mothers and their babies, and watched their babies grow, and helped to vaccinate and teach, and that has led me into many years later, outside of clinical work, becoming a nurse educator. And this is extremely exciting because it means that I can impart the skills and the knowledge that I have learned as a nurse to others who are wanting to become nurses. And part of what I always try to do is let them know how much I have loved nursing. It has taken me all over the world. My very first job was in a refugee camp on the Thai-Cambodian border during the end of the Pol Pot era, and working in an emergency room. And so I have always been drawn to global health nursing and working with people from all over the world, all shapes and colors and sizes and socioeconomic statuses. The beauty of nursing, as Florence Nightingale first taught us, is that it really is a holistic approach to the care of the human at all stages of life, from birth to before birth to death, and beyond, to the support of families and friends and community. And a little bit different than medicine, and I won't downgrade medicine. We are a partnership. We work as a team. We can all contribute to the care of the world and the people that we want to help. But it does focus, nursing does focus a little bit more broadly and holistically on the entire person. And it's the psychological, the physical, the emotional, and really the contextual. You know, where is this person living and breathing and growing? And how can we work within that situation to provide the best and most healthy care to them and their families? And it doesn't matter where I've gone in the world or what I've done. Nursing has always basically promoted this same paradigm, this same way of looking at nursing. It is always holistic, whether you're in the refugee camp or you're teaching in the simulation lab in Tanzania, or working in the primary care center at Children's Hospital. Even as a contact tracer, I brought my nursing skills and my love of the entire person and the family to what I did in talking with families about staying safe during the pandemic. I just want you to know that it has been a wonderful career. It is not over. I will continue to be a nurse as long as I can. And I'd really like to encourage anyone to reach out and explore it as a profession. And I can't begin to tell you how happy it has made me in my life.
Nanipaga moyo nikianza kulia chozi nafutia.